Imagine this. You're not feeling well. Maybe your head is just throbbing, or your stomach's doing flips. You know you need to see a doctor, but then this other kind of ache hits, trying to explain exactly what's wrong in English, especially if it isn't your first language.
Yeah.
You might be trying to say, my head feels like a bomb, or maybe like someone's squeezing my head, and the words just, they don't quite capture it.
Exactly. That language barrier, it can almost feel like another symptom, just adding to the stress.
Well, you've definitely landed in the right place today.
Mhm.
We want to arm you with those essential phrases, help you understand the whole process, basically, so you feel heard, understood, and you get the best care.
And it's not just about feeling comfortable, though that's important too. This is actually crucial for your health, for your safety.
Really? How so?
Well, consider this. It's quite striking. Some studies suggest that up to 70%, 0% of medical errors are linked in some way to communication breakdowns.
Wow, 70%. That's huge.
It is. Breakdowns between the healthcare providers and the patients. So it really highlights just how vital, clear, effective communication is. It impacts everything from getting the right diagnosis to the correct treatment.
That's a really critical point.
Mm.
So, okay, to make sure you, our listeners, can bridge that gap, we've kind of distilled insights from, practical guides, vocabulary lists, real conversations. We're basically going to guide you through every step from just booking the appointment all the way to understanding your recovery. Ready to jump in?
Let's do it.
Okay, so before we even picture being in the examination room, there's that first hurdle, isn't there? Actually getting the appointment made. What's the key language here?
Absolutely. That first call can feel daunting. The most common phrases you'll want to use are pretty straightforward.
Mm-hmm.
Book an appointment or schedule an appointment.
Oh,
So you might call and say something like, "Hi, I'd like to book an appointment with Dr. Smith." It's also helpful to give a brief reason like, "I've been having severe headaches for a few days."
right, give some context.
Exactly. Then the receptionist will usually ask about the doctor's available times or maybe when you're free.
Gotcha. And when we talk about where we're going, I've heard different terms used. Is there a difference between, say, the US and the UK?
Yeah, there's a subtle one that can catch you out. In American English, you'll mostly hear doctor's office or maybe clinic.
Okay, office or clinic,
But if you're in the UK, you'll often hear it called the surgery.
surgery, like where they operate.
No, not usually. It's just the term they use for the GP's office. It can be a bit confusing at first.
Good to know. And you mentioned GP.
Ah, yes. GP stands for general practitioner. Think of them as your family doctor, the one who handles general health issues. They're usually your first port of call for most things.
Right, your main doctor. But what if it's something specific, like, I don't know, a skin thing that keeps coming back, or maybe chest pain? Do you always go to the GP first?
That's a really good question. It often depends on the healthcare system you're in, but yes, frequently you'll need what's called a referral from your GP to see a specialist.
A referral,
Yeah.
okay.
So a specialist like a cardiologist for heart problems or dermatologist for skin issues, they focus on one specific area. Your GP checks you up first, and if they think you need that specialized expertise, they write the referral. It helps make sure you see the right person.
Makes sense. Kind of coordinates the care. So once you've got that sorted, the actual meeting with the doctor, whether it's the GP or that specialist, that's called the consultation, right?
That's the term, yes.
Hmm.
The consultation. And when you're booking it, you'll definitely talk about availability. What does that mean here?
Availability, like when they have openings.
Exactly. It's just about the time slots, when the doctor is free or when you are free to come in. The receptionist might ask, "What's your availability like next week?" Or they might tell you, "Dr. Smith's next availability is Tuesday morning."
Oh, okay.
Now, there's another important word, urgent. If your condition sounds serious when you call, they might classify it as urgent.
And that means?
That means it needs quick attention. Getting marked as urgent often bumps you up the list, gets you an appointment much sooner.
That's good to know, especially if you're really feeling unwell. Okay, let's fast forward. Appointment booked. You're actually at the hospital or clinic. Sometimes just finding your way around is, well, another challenge.
Oh, absolutely. It's very common to feel a bit lost, especially in a big place you haven't been to before.
So what can you say?
Don't hesitate to ask.
Yeah.
Something simple like, "Excuse me, can you show me where Dr. Smith's office is?"
Yeah.
Or "Where's the reception desk?"
Right.
Once you get to reception, you might see a ticket printer. That's often where you get a number for the queue.
Ah, like at the deli counter. Sort of. You pick up your number and then you wait for your turn. You'll deal with the receptionist there, and then later, you'll likely need to find the pharmacy for medicine or the cash counter to pay any fees. Knowing those words helps a lot.
Definitely eases the anxiety. Okay, we've navigated the building, survived the waiting room. Now, the main event, the actual visit.
Yeah.
How do you make sure you communicate effectively in there? What's that initial exchange like?
Right, so you're called in. You might politely ask, "May I come in?" Or just wait to be invited. The doctor will usually kick things off with a question like, "So what brings you in today?" Or maybe, "What seems to be the problem?"
That's your cue.
That's your cue. And it sounds basic, but stating your name and age clearly right at the start is really helpful. My name is your name, and I'm your age. It helps them pull up the right records quickly.
Good tip. Okay, now for maybe the most critical part, describing your symptoms. This is where words really matter for the diagnosis, right? How specific do you need to be? You need to be as specific as possible. Think of it like giving clues to a detective. The more precise the clues, the faster they can solve the case. Or in this case, figure out the diagnosis.
So not just, "I have pain."
Definitely not. Describe the type of pain. Is it a severe stomach ache? A sharp pain somewhere specific? Maybe throbbing headaches?
Throbbing. Yeah, that's descriptive.
It is. Patients might say things like, "My back hurts like it's killing me," or "That headache example you gave feels like someone squeezing my head." Or maybe it's a sore throat. Or you can say, "It hurts a lot when I try to stand up," or "when I walk." Those details are gold.
And it's not just pain, is it? There are other feelings.
Exactly. You might feel a little feverish, or maybe you've had bouts of vomiting. Feeling dizzy or just incredibly tired are common symptoms.
Or like no appetite.
No appetite at all, yes.
Right.
Or maybe trouble sleeping, insomnia. And then there are physical signs you can point out. Swelling anywhere, a rash, maybe something feels itchy.
What about breathing?
Good one. A dry cough, or feeling short of breath. We also hear things like, "My ankles have been swelling lately," or "My neck feels kind of swollen here." Pointing while you describe helps too.
So naming the symptom is step one. What else does the doctor need to know?
They'll want more detail, the how and when. They'll definitely ask about severity. You mentioned the 1 to 10 scale.
Right. On a scale of 1 to 10, how bad is the pain?
Precisely, with 10 being the absolute worst. They'll also ask about the type again. Is the pain sharp, dull, or throbbing? Sharp is like a sudden stab. Dull is more constant and achy. Throbbing often pulses.
Okay. Sharp, dull, throbbing. Got it.
End timing.
Crucial. How long have you had these symptoms? When exactly did it start? Also, did it come on suddenly or did it develop gradually over time? Importantly, has it gotten worse?
That makes sense, building a timeline.
And they'll look for patterns or triggers. Have you noticed anything that triggers the symptoms or makes them worse? Like maybe certain foods or stress?
Or makes them better. Or makes them better, yes. Are the symptoms different at certain times of the day? Morning versus night, for example. And sharing your history is key. Have you had this kind of stomachache before? Or is this the first time this has happened? All these pieces help them put the puzzle together.
Okay, so we've given them all the clues, described everything in detail. Now comes the part where they, actually check you out, the physical examination. What happens then?
Right. The doctor will likely say things like, "Okay, let me take a closer look," or "I need to check your temperature." If you use the stethoscope, they'll say, "I need to listen to your heart and lungs," and might ask you to take some deep breaths. For a sore throat, it's the classic open wide and say, "Ah." During this, they might press on an area, maybe your abdomen or neck, and ask, "Does it hurt when I press here?"
And you should just be honest, right?
Absolutely. Respond clearly. "Yes, that hurts quite a lot," or "Ouch, yeah, that's really sore right there." Don't downplay it if it hurts.
Good advice. After they've done the physical check, what often comes next? Maybe tests?
Often, yes. Depending on what they suspect, they might order some common tests. This could be an X-ray to see bones or inside your chest, blood work, taking a blood sample to check for infection or other things, or maybe a throat swab if they think it might be strep throat.
Throat swab. Not the most fun.
Not the most fun, but quick. The results from these tests, the test results, will give them more information. You'll usually need to come back or get a call about those.
Okay. Now, this is important too. It's okay for us, the patient, to ask questions and express concern.
It's more than, okay, it's essential. This is your health. You should absolutely feel empowered to ask things.
Like what? What are some good examples?
Well, if you're worried, you can ask directly, "Is this something serious, doctor?" Or if the symptoms are really impacting your life, "What can be done right now? I can barely work because of this pain."
Right. Focus on the impact.
Exactly. You can also ask about the treatment plan. Will I need antibiotics?
Yeah.
Or is there any medicine you can give me for this? A very common and practical question is, how long do you think it will take to heal?
That helps manage expectations. What about specific fears, like if someone really hates needles?
That's a common one. You could voice that preference. I'm quite nervous about injections. Would it be possible to get medicine instead? A good doctor will understand and might reassure you, perhaps saying, I understand. This injection gives very fast relief, though. It'll just be a tiny prick. You likely won't even feel it much.
Okay.
And definitely ask about the future. Should I be worried about this long term, or will there be any after effects I should know about? Getting that clarity is key for peace of mind.
Definitely. So after the questions, the examination, maybe the tests, the doctor usually gives a diagnosis, right? Their conclusion about what's wrong.
Yes. They'll name the condition. It might be something like food poisoning, or if you fell, maybe a sprain in your ankle. For headaches, it could be migraines. Throat pain might be strep throat, or a rash could be allergic reaction.
And then they explain the plan.
Exactly. They'll outline the next steps clearly. You might hear, okay, I'm writing down some tests I want you to get, or I'm going to prescribe some medication for you.
Prescribe, meaning write a prescription.
Correct. Or if you need fast pain relief, I'm giving you an injection now for temporary relief. In more serious situations, they might say, based on this, I think you need to be hospitalized. But they will explain the treatment plan.
And when they prescribe medication, that's another area where clear understanding is crucial. What terms do we need to listen for?
Absolutely vital. You need to be crystal clear on the dosage. That's how much medicine to take and how often. For example, take 1 pill twice a day.
Dosage. Got it.
And listen carefully to the instructions. Is it take with food, or on a full stomach, or maybe on an empty stomach? These instructions affect how well the medicine works and can prevent stomach upset.
Right, those details matter.
They really do. And always ask about potential side effects. Those are any unwanted symptoms a medicine might cause. Knowing what to look out for helps you react quickly if something doesn't feel right.
That's really practical advice. And doctors often try to reassure you too, don't they?
Yes, you'll often hear things like, okay, don't worry too much about this, or it's nothing serious. We see this quite often. Or maybe it's good that you came in when you did. We'll get this figured out. But even with reassurance, if you don't understand something,
Ask again.
ask again. Absolutely. Ask them to repeat it, or maybe phrase it differently. Your understanding is the top priority.
Okay, so the consultation is wrapping up. Let's talk about what happens after the visit, the follow-through. You mentioned getting a prescription. Where do you take that?
Right. You'll usually take your prescription, that paper the doctor wrote to the pharmacy. Sometimes it's in the clinic or hospital. Sometimes it's a separate shop.
And the person there is
The pharmacist.
Mm.
They are a crucial part of your healthcare team. They prepare your medication, but more importantly, they usually explain the dosage and instructions again.
Oh, good. Reinforcement.
Exactly. They'll double-check you understand how and when to take it, and they'll often remind you about common side effects. It's another chance to ask questions if anything is unclear. Don't just grab the bag and leave. Make sure you understand.
Great point. What about future appointments or check-ins?
The doctor might want to see you again. They'll schedule a follow-up appointment. Or they might give specific instructions like, come back immediately if the pain gets worse, or call us right away if you develop a fever.
Okay. And payment?
You might be directed to submit the fees at the cash counter or reception before you leave, or they might bill you later, depending on the system. But through this whole journey, from the first call to feeling better,
Communication is key.
it's the thread that runs through everything. Being clear about your recovery, any rest you need, and when you should seek more help, it's all part of ensuring you get well safely. It really is a conversation.
So wrapping this up, what does this all mean for you listening? Well, navigating these medical conversations in English, yeah, it can feel like a big challenge, especially when you're feeling vulnerable and maybe the stakes feel high.
They often do.
But hopefully, as we've walked through today, you can see that with a clearer picture of the process, knowing some of these key phrases, and crucially, having the confidence to ask your questions, it really does become much more manageable.
Absolutely.
This deep dive was really about arming you with those practical tools for every step of that medical journey.
And ultimately, feeling well-informed, feeling like you understand what's happening, that's the best shortcut to getting effective health care. You really do now have the tools, hopefully, and the understanding to be an active participant.
Yeah, an empowered participant.
Exactly. Making sure your voice is genuinely heard, your concerns are addressed, and your needs are properly met.
So here's something to think about as we finish. Reflecting on your own experiences, or maybe thinking ahead to a future doctor's visit. What's one specific phrase or maybe a type of question from everything we've discussed today that you now feel more confident you could use or ask your doctor in English next time? How can you personally make sure your voice is truly heard and your concerns are fully understood in that important moment?